about the basics of ventilator part 1, that is physiology portion. What is respiration? Respiration is oxygen in and carbon dioxide out. If it occurs at the cellular level, then it is internal respiration, and if it occurs at the lung, then it is external respiration. What is ventilator? Ventilator is a device that provides breath to the lung. And what is the difference between ventilator breath and spontaneous breath? Ventilator breath is defined as movement of air into the lungs by the application of positive pressure to the airway. But spontaneous breath is defined as movement of air into and out of the lungs as a result of work done by individuals' respiratory muscles, and inspiration happens here due to negative pressure generation within the airway, so that air sucked within the airway. So here basic difference between ventilator breath and spontaneous breath is, in ventilator breath there is positive pressure generation and air pushed in, and in spontaneous breath there is negative pressure generation and air sucked in or pulled in. Next, alveolar arterial oxygen gradient. Gradient means difference. So alveolar arterial oxygen gradient means difference in oxygen concentration between alveoli and the blood. So equation is P capital A O2 minus P small a O2 is equal to FiO2 into airway pressure minus PCO2 by respiratory quotient minus PaO2. Airway pressure means barometric pressure minus water vapor pressure. If FiO2 is 21%, barometric pressure is 760 mm Hg, water vapor pressure is 47 mm Hg, PCO2 is 40, respiratory quotient is 0.8, and if PaO2 is 70, then alveolar arterial oxygen gradient will be 30 mm Hg. It should be 15 to 30 mm Hg in neonate with breathing in room air. It is important because gas always diffuse from areas of high pressure to low pressure. If gradient is abnormally more, then it is suggestive of diffusion abnormality at the level of alveoli, interstitium, or blood. And pathologies may be pulmonary edema, pulmonary hemorrhage, persistent pulmonary hypertension, right to left shunting, collapsed lung, or ARDS. Next, generation of respiratory tree. There are total 23 generations in the airway. First 16 generation is conducting zone and do not participate in gas exchange. This is known as anatomical dead space. Next 7 generation are respiratory zone and they participate in gas exchange. They are respiratory bronchiole, alveolar duct, and alveoli. Next, mechanism of spontaneous respiration. Before spontaneous respiration can happen, chest cavity should become a negative pressure chamber by increasing its volume so that air can be sucked in the airway. So there is three basic movements to increase the volume of the chest wall cavity during spontaneous inspiration. Number 1, increase in vertical diameter by diaphragmatic contraction. Number 2, increase in anterior posterior diameter by pump handle movement, that is upward and anterior movement of the sternum by sternocleidomastoid in sagittal plane, and upper 7 ribs also moves upwards due to their horizontal arrangement and direct attachment to the sternum. Here is the image of pump handle movement of the sternum and upper 7 ribs. This is the pump. This moves in upward direction and anterior direction in the sagittal plane. Number 3, increase in the transverse diameter of the chest wall by bucket handle movement, that is lateral movement of the lower ribs in coronal plane due to their angulated arrangement and indirect attachment of the sternum. By these three mechanisms, volume of the chest wall cavity is increased and pressure within is decreased. So generation of the negative pressure within the chest wall cavity and air sucked within the airway. Next, there are three important respiratory pressures. Number 1, alveolar pressure or intraalveolar pressure or intrapulmonary pressure. Number 2, pleural pressure or intrapleural pressure or intrathoracic pressure. Alveolar pressure may be positive or negative, but pleural pressure is always negative but becomes more negative during inspiration. Transpulmonary pressure is difference between the alveolar pressure and the pleural pressure. Transpulmonary pressure is alveolar distending pressure, which should be increased during inspiration. In spontaneous breathing, it is increased by decreasing the pleural pressure, but in ventilator breathing, it is increased by increasing the alveolar pressure by giving positive pressure ventilation. In this pressure time and volume time graph, lower curve is pleural pressure curve, middle curve is alveolar pressure curve, upper curve is lung volume curve. During the peak of the inspiration, pleural pressure becomes more negative. So transpulmonary pressure is increased during the peak of the inspiration and lung volume is increased. and during the expiration pleural pressure becomes less negative, so transpulmonary pressure becomes less, so lung volume is decreased during expiration. Next, in this slide we discuss about the mechanism of spontaneous ventilation and positive pressure ventilation. In spontaneous breathing, inspiratory muscle contract first, so intrathoracic volume is increased. As volume increase, intrathoracic pressure drop down, pressure drop down. As pleural pressure decreased, transpulmonary pressure is increased, because transpulmonary pressure is the difference between alveolar pressure and the pleural pressure. As transpulmonary pressure is increased or alveolar distending pressure is increased, lung volume is increased. As lung volume is increased, alveolar pressure decreased. As alveolar pressure decreased, air flows into the lung until the alveolar pressure equals to the atmospheric pressure. What is the mechanism of positive pressure ventilation? Here, ventilator increases proximal airway pressure by giving PPV. Air flows into lungs, alveolar pressure increased, so transpulmonary pressure is increased, because transpulmonary pressure is the difference between the alveolar pressure and the pleural pressure. Then, as transpulmonary pressure is increased, transpulmonary pressure is alveolar distending pressure, so lung volume is increased. Next, oxygenation. How oxygenation happens in the tissue? Tissue oxygenation depends on three factors, but ventilator helps in only one factor. Factor 1, transport of oxygen from atmosphere to the blood via airway and lung, that is done by the ventilator. Then transport of the oxygen from the blood to the tissue, that is done by the hemoglobin. And third, tissue perfusion, because of cardiac output and systemic venous return. Oxygenation from alveoli to blood depends on two important factors, FiO2 and MAP. FiO2, 1% increase in FiO2, P capital AO2, that is alveolar oxygen concentration increased by 7 mm Hg, and arterial oxygen concentration increased by 5 mm Hg. Mean airway pressure. Mean airway pressure is area under the curve in pressure times scalar graph. So mean airway pressure depends on four factors, Ti, PIP, PWP and TE. An equation of mean airway pressure is Ti into PIP plus TE into PWP divided by total time, that is Ti plus T. If mean airway pressure is increased, oxygenation is also increased. Next, CO2 removal. For effective CO2 removal, we have to increase the minute ventilation, that is the tidal volume into respiratory rate, and ED parameter. Factor 1 is tidal volume. If we increase the tidal volume, then CO2 removal will be more. And tidal volume is represented by difference between the PIP and PWP, that is the delta pressure. So we have to either increase the PIP or decrease the PWP. Then we have to increase the respiratory rate for effective CO2 removal. But rather increasing respiratory rate, we should increase the expiratory time for more effective CO2 removal. Factor 3 is ET tube parameter. We have to choose ET tube size as per the birth weight. Then position of the ET tube tip should be 2 cm above the carina, and there should not be any block due to secretion or any other reason.